Good morning, Singapore, and welcome to the big show. It is a Tuesday, and that's why we have with us award-winning psychologist from the therapy room, Dr. Geraldine Tan. Good morning, Jerry.
Good morning, and I'm back in Singapore.
Welcome home. This is home, truly.
Welcome back. You had a good break?
It is. It was a hectic, but it was a very interesting trip. And
Nice.
very nice.
So you went to Istanbul. Where else do you go?
Switzerland, Prague, and Turkey.
How is Prague?
Prague is interesting. It has the medieval, the Baroque buildings, the Renaissance buildings, so a lot of history also. So I felt like I was going for a history tour.
But how are the people over there? Are they all mentally stable?
Hey,
Oh,
Glenn.
Sorry.
Straight up, ask it.
Wow.
Yeah.
Okay,
Well,
moving on.
okay,
Sorry about that.
well,
So we're talking about caregiver stress this morning.
And before we get into that, remember, if you have questions for Dr. Jerry regarding caregiver stress, please put them through in our comments column, and we'll try to get Jerry to do
Because
it.
of our aging population,
Yeah.
we have many members of the family who are
Who
caregivers.
are caregivers.
Yes, and also,
Yes.
I mean, the population is aging, and a lot of these caregivers are also aging. It's not necessarily their children or the younger ones that
Yes.
are looking after them.
Yes.
So why this topic today?
So, growing population is something that is very real in Singapore. You know, I think earlier in the year, we already saw the numbers. You know, one in 5, I think, and then very soon it would be 1 in 4 in 2023, as in projected. 1 in 4 would be above the age of 65. Yeah, and you know, recently we've been dealing a lot with the elder care centers. So many of them were asking for caring for the carer talks, you know, so caregiver stress. So just last evening, I did the caregiver stress talk. So I thought, why not bring it on air today also? Yeah, and it's really, I mean, we had a really lovely discussion last evening, but yeah, the different sort of illnesses that people have, you know, it's not just dementia. Dementia is something that is in the media, that has been spoken about, but it's not just dementia. It is also about geriatric depression. There is something called geriatric depression, anxiety, mental health issues.
Right.
They do have that. Stroke patients, Parkinson's, those recovering from cancer. Yeah, so caregiver is not just limited to the growing population, but also those that require long-term care. So, for example, children that have cancer and parents have to look after these children. So they are also caregivers.
Right.
So there's a whole range of different illnesses that require a lot of long-term caregiving.
Right.
Yeah.
Okay, Jerry, let's continue this conversation on the Big Show TV. Up next, Sabrina Carpenter. This is Feather on Kiss 92.
So, Dr. Jerry, you're talking about caregivers across the spectrum because you mentioned, although we have an aging population, caregivers looking after the elderly, caregivers looking after the children. I just became a pet owner. Caregivers looking after their sick pets as well. It's anything to do with caregiving, right?
Definitely. Yes. So, you know, long-term care, and it stresses the person. And let's look at when the person is ill. Why it makes it a bit more, even tougher. You know, it's not just the illness itself that we need to look out for. If it's just the illness itself, we can deal with it. But it is the person that is ill being a bit more irritable. You know, when you're ill, you have
Of
a
course,
fever,
yeah,
you're a little bit more irritable, a bit more demanding. Sometimes they can even get violent, not just physically, but also verbally.
Yeah, I mean,
You
what's
may
worse is you're
scream at
old,
you and
right?
shout.
You're old and you're ill.
Yeah, because
know?
and when you're, you don't even have to have a fever or be health-wise sick. You can just be invalid. And that already is frustrating, because everybody else is running around and you used to be this active person and you can't do stuff on your own. So that in itself is annoying.
And the stressful thing about being a caregiver to someone, who is in that predicament, right, is that the words, that come out of your mouth every day. You don't want them to feel like, they're hopeless.
Yeah, for sure.
You need to still be encouraging and all that. But that in itself is so difficult.
It's hard.
It is hard. It is difficult. So some of the caregivers were sharing, it is difficult when the one that is ill or the one that they are looking after cannot see that the caregiver is there. And would say words like, you want me to die, I've got no one. And the caregiver is like, I'm here, am I invisible? Why are you saying that? You've got no one, nobody cares for me. So the words they use become very harsh and very jarring to the caregiver.
But it's
which
also
makes it very demoralizing.
But it's also because of the behavior of, let's say,
the caregiver.
I think maybe some caregivers are better than others. Some caregivers may know how to handle the situation. Some, as a result of stress, might be a bit harsh. Let's say, family members may not necessarily understand the situation. They might look at the the patient as a little bit of a burden.
Of course. Not everyone's built to do that.
So all this is felt by the patient, you see. They're extra sensitive. And they can feel the people around them. And as a result, they feel sad.
Yeah, because every time I see my dad, I'm like, so how are you feeling today? He's like, why does everyone keep asking me that? And I said, because we just want to know how you're feeling, But if I think about it, I don't say that to my mom, how are you feeling today?
Yeah.
You know what I mean? It's just like, how are you?
They want to be treated like everyone else. And we forget that. We tend to overcompensate.
And over fuss, right?
Actually, I don't know about that. They want to be treated like everyone else, but then again, they don't.
Yeah, there is a fine line between the two. They want the attention, and yet they don't. Yeah.
How do we deal with a situation like that, Jerry?
I think it is straight up, asking them. So, for example, Angel's dad says, why does everyone ask? Oh, then maybe it's asking dad, well, how would you like me to ask you then? And if he says, just ask me like how you ask mom, and then we know, right? Or maybe he's just irritated on that day, and it's not because of your question. It can be various reasons why they react in a certain way.
Well, that's because he's not allowed to have any alcohol or meat ever again in his life, I'm sure.
Well, there you go. That's going to set him off.
Upset.
That's going to set him off for
He's
sure.
like, you can't have his beer. You can't
Never?
have
Not even
nothing.
Oh.
Yeah.
He was there for a long time. He was in hospital for 4 strokes. I mean,
Yeah.
He was there for a long
he can have his Carlsberg Zero and stuff like that. But that's it. I feel him.
Well, he doesn't just go for it sometimes. I mean,
No, he can't. Well, he can't like up and run, right?
But I
For
think
the alcohol
I think sometimes the caregiver also needs to think about the person they're caring for, because sometimes that person says things because they feel they are a burden.
The caregiver?
No,
right.
The person that is being cared for feels that they are a burden, and they don't know how to deal with that.
Yeah, they don't want to be a burden to anyone.
So they just explode.
Yeah.
I don't want to do this to you. I don't want to do this to you, but I have no bloody choice.
Yeah.
And then the family member will look at you and go like, you see? All these years, I told you already, right? To quit smoking.
Oh,
Yeah,
my
whatever,
gosh.
yeah.
But you
the
continued,
blame.
right?
Yeah.
Now
Yeah,
you're
yeah.
putting us in this position.
Oh, there are
because
people.
Of, right, I mean,
Yeah.
Yeah,
do
there
that.
are awful
Or,
people like that.
We told you already, you can't eat the car every day, right?
Yeah.
And then now you are in this position, you are burdening everybody now.
Yeah.
That's
Right.
the wrong thing to
that's
say.
a terrible
at any point.
thing to say.
But
Yeah,
there
at
are,
any
I'm
point
sure
in time.
there are caregivers who
course.
kind of like lose it because they're
Sure.
Again, not
they-
built for it.
they're stressed out.
They're
and-
stressed out.
Well, let's look at the caregivers, right? The caregivers also feel stress. Who goes into any developmental timeline and say I'm going to be a caregiver.
Yeah.
Hold on, Jerry.
No one says that.
We go on here, and
Okay.
we'll go with this question. Welcome back to The Big Show and The Big Show TV. We're with Dr. Geraldine Tan from the therapy room, and we're talking about caregivers today and how some caregivers are under really a lot of stress, and how some caregivers just can't seem to deal with certain situations. How do we help these caregivers? Caregivers who are tuned into us right now, who are just losing it, who are having these bad thoughts right now about the people they are caring for.
Yeah, thoughts you wouldn't normally have.
Yeah.
Well, let's call out the white elephant in the room, right? Because a lot of times caregivers didn't ask to be caregivers. They didn't choose to be caregivers, but they are put in that position. And I would say kudos to many of them. They gamely take on that challenge very patiently, but they are also human beings. So they can be subjected to a lot of depressiveness, anxiety. They are there worrying for the other person. And a lot of them mention about, the lack of sleep, about when it continues, they have insomnia. I had one client that came, 3-4 months after her parent had passed away, and she says, I thought I can sleep better, but I cannot sleep at night. I'm still having my insomnia. And if we go back to the whole long-term caring process, a lot of times caregivers are on hyper alert when they are on duty, especially if they take on that night duty. They're not sleeping properly at all, They are hyper alert, listening out to whether there is a little bit of sound, and a little bit of sound, they'll sit up and go, what do you want? What do you want? You want to go to the toilet? Or they are listening out and worrying whether the person had fallen down yet again. Because we know with many of the illnesses, whether it is dementia, stroke, Parkinson, and especially with the those more advanced in age, mobility is an issue. So they would not be sleeping well for like a few years.
Yeah.
So this particular.
And what about patients who refuse to cooperate? Everyone everyone is trying to take care of them, but they're not listening to anyone. They're stubborn.
Yeah.
Well,
they're doing whatever they want. They're eating whatever they want. They're constantly fighting their caregivers.
Yeah.
CHCO has come onto our Facebook and he said, Dear Dr. Jerry and the KISS crew, my father's been hospitalized for nearly a month. He had his pacemaker surgery just carried out. It was delayed because of a fever. He was bedridden for a long time, and that resulted in muscle loss. The hospital recommended that he go into a community hospital for rehab, and he refused it straight, saying that he's fine and able to manage on his own. It's just one of those frustrations of a sole caregiver.
No, I feel you, because my family went through that last year as well, put him in a community hospital, which he did go into, or bring him back home, and obviously we did, because that was the, but my parents had the means to do that. Not everyone may have the means to create a home situation or environment for their family members.
Yeah. Okay, let's continue to talk to Jerry on The Big Show TV. It is 8:14.
Kiss 92 Time Check, brought to you.
But I think he can't look at a community hospital as being a home. It's not.
It's not.
It's for rehab.
It's for rehab,
It's
and
for
he is
rehab.
refusing the rehab up straight.
My dad went through that as well.
And a lot of people, when you start to talk about rehab and you talk about muscle loss and you talk about this, they suddenly go, I'm an invalid.
Yeah.
But maybe if
And
he
they
sees,
don't want to admit that.
if you tell your dad that the final goal is to get him home, that might
It might
encourage
work.
him as
It's
well.
just
Just a
that-
little while.
It's just that the environment is,
It's-
I've been to one of
it's
these
like a
rehab
hospital.
homes. I've
Yeah.
had friends who have suffered strokes and all that, and they had to go there for rehab. It's just everyone in the same
Situation.
situation,
Yeah.
the same room. There are many beds.
Yeah.
But yeah, I think some people don't understand, right? They think of it as this is like the final place I'm going to go to. right?
Exactly.
It's the home for the
The
sick.
forgotten.
Yes.
The sick,
Yeah.
yeah.
And they're
Yeah.
afraid they'll never leave the place.
Yeah.
But you're right. Rehab. I know I've seen it for myself. They take these patients out for walks around
Yep.
the area.
Yeah.
They do some strengthening exercises.
Yeah.
They make sure that the diet is clean and
Correct.
and that they're nourished.
It's a preparation to go home. What's this guy's name?
CH.
CH. Yeah, just tell your dad, it's a little bit of a middle ground, and you need to get this done before you can go home.
Yeah.
Because if you don't get this done, then you can't come home. What's
Yeah.
what's the end goal here?
But what would you say, Jerry, to a caregiver who is going through immense stress now because the person they're looking after is being extremely uncooperative?
So the team, you usually have a medical team behind you, so it can be a collective decision with the doctor, sit with the entire team and sit with the one that is having to go to the community hospital, because the community hospital, although we say is rehab, can be quite scary, can be quite depressing for the person also, but we also understand the caregiver. However, the caregiver is not the one to make the it's not the only one to make that decision. Everyone can make that decision together, and come to some form of compromise. I think a lot of time for the caregiver, they have a lot of guilt placed onto them and into them, where they feel that they are not doing enough. Whatever that they do is just not good enough. And they feel, so like earlier we were talking about like having bad thoughts. And even having bad thoughts, they feel guilty about having bad thoughts. They feel guilty about being frustrated. They feel that they have to hold up everything. They feel like, if they crumble, the whole system will crumble too. They are the only one that the system is depending on. So there's a lot of heaviness with on the caregivers themselves, and they are afraid of burdening anyone. So they are the ones that keep quiet if they fall sick, if they're not feeling well. They just bottle in everything and just shut in everything, which makes it worse for their mental health. So we always encourage them to continue to work with the medical team.
Yep.
And if, let's say, there is a community for them, that means family members of other, caregivers, that means other caregivers. And it was really lovely to see the caregivers coming together last evening. And there were about 30 over of them, where they can share and swap stories. Now, sharing and swapping stories is not just complaining or ranting. It is expressing. It is when you express, you realize, oh, I'm not the only one going through it. There is someone else, because caregiving is a very isolating journey. You and the other person. And you don't know whether whatever that you're going through is right or is wrong, or that, are you going insane? Are you normal? So it's very tough for them, and having that community helps them to understand that they are not alone in this.
I think it's also very important for families when a member of the family requires a caregiver. Families need to understand that the entire family is the caregiver. Just because that person is staying with one member of the family,
Other people need to get
doesn't
involved.
mean
yeah.
the other people don't get involved. And visiting that person on a Sunday is not getting involved.
Yeah.
But going to the caregiver and going, hey,
Take a day off.
it's Friday, I'll take over, go.
No, that's true.
That's what's important. And I know of families where that does not happen.
Yeah.
But what
And one person is left looking after
Yeah,
this,
it's
this,
tough.
This member of the
But if
family.
it's too much of a burden and it's interfering in, let's say, the daily lives of the caregiver and the caregiver's family, right? Because, I mean, the caregiver probably has his or her own family to take care of,
Yeah.
has to go to work, and there's nobody else. Like maybe just a helper who might be taking care
Or
of,
not even
of the
trained.
patient. Or not,
Yeah.
not even trained. And some people, maybe they don't even have a helper.
Yes.
You know, and as a result, they don't have this peace of mind. And so what I'm saying here is that, is it really that bad to put this person into a home?
It's a very difficult
It's a tough
one.
question.
It's a tough question. If we look at the community home, right, or community hospital, there's
Yep.
all the rehab and the nurses, but people are resisting it. And we need to understand why they are resisting it when there is a lot of professional care there. We were discussing last night that there is help for the caregivers. So AIC, yes, the integrated care provides a service where they allow the caregivers to apply to have the one that is ill placed or to put your loved one in a home for perhaps a week, maximum 30 days, for the caregiver to have some respite.
Oh, wow.
So
Okay.
there
that's good.
Okay.
is a
Yeah.
service there. Yeah. So at least, the caregiver can take a break, can do
Yeah.
what they need to do for a maximum of 30 days. But there's a long wait list.
Yeah.
And you would probably have to apply early. But then again, not everybody would take that option, you see.
No, but I mean, the thing is, I think my dad had that as well. After being in the hospital, he was shifted to the community hospital, and they said they could only do it for 30 days because there is a long wait list. And it took him
Yeah.
a while to even get into that, right?
Yeah.
Right.
But I mean, I don't see my mom having had more respite because she still went to the community hospital every day.
Yeah.
And she's still worried about him,
Yeah,
So
yeah.
I don't know how much, for me, I don't know how much R&R really it offers the caregiver to have somebody else look after the patient.
Yeah, but can the care... Okay, hold on. We'll go back on air. Welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Geraldine Tan from the Therapy Room, and we're talking about caregiver stress today. I just want to say, Jerry, for some caregivers who are under extreme stress, who have not had a break in a long, long time, like we were talking about earlier on, Angel, and you were saying there are places like AIC, for example, where some people can, put their loved ones in the care of AIC just so that they have some respite, so that they can recover.
Yep.
Because it's an ongoing daily thing
Yeah, of course.
for some of the caregivers, and it might take its toll
Yeah.
as a result. You were saying that it's difficult because it's usually fully booked. Is that what you're saying, Jerry?
There's a long wait list. Apparently there's a long wait list. There's a long queue to
okay.
even apply for that. Yeah.
Are there even enough of these integrated care centers to handle the aging population? Do you think?
Well, there are more that are coming up, I think, to cater for the increasing growing population. Yes, but everyone can play a part. That's what we are looking at. That everyone can always chip in, and also for the caregivers to remember to pace themselves. So a lot of times, the caregivers just go full on, and that becomes their 24/7 job.
But that's easier said than done, though. How do you tell someone to take their break off the accelerator when a loved one is not well, needs the attention, is grumpy, is constantly asking for things?
But at the end of the day, the more you push yourself, the less effective you're going to be.
You can say that, and
But
it's hard. It's hard to
for
do.
anyone to recognize it.
It's
Yeah.
very hard to be that person.
I think that's why we sit here and, we talk about it. But hearing from the caregivers themselves really was quite heartening, where they really make time for that cup of coffee, to go out on a date with their spouses, to spend time with their children. And they say it does take effort, but they need to make that effort to make it happen. So it can be done. All of us have the ability to do so, to prioritize our time. Yeah.
It is such a difficult situation.
It's hard.
It
It's
is.
so hard.
Because I mean, I would love
It
to say
is.
like, okay, just hire a nurse or something like that, but that costs a lot of money.
Of course, and like, but I'd like to also say that from the point of view of someone who has someone who needs caregiving, if the ill or the person who is not so well has gone through maybe a stroke is of sound mind,
Yeah.
they need to go easy on the caregivers as
Of
well.
course.
Yeah.
You know what I mean?
Yeah.
And some of them, they really take advantage
They do.
of not being able to do stuff, and they're
They
like,
do.
"You get me this, you get
Yeah.
me this." You know what I mean? You
Yeah.
really need to take your foot off the accelerator and stop doing that.
Absolutely.
There's a very interesting question that we'll deal with when we come back on Facebook regarding a comment that Glenn made.
Okay.
All right. Up next, Olivia Dean featuring Leon Bridges. Here's the hardest part on Kiss 92.
What did Glenn do now?
Yeah.
No, and I see the point.
What did
and
I see?
I'll ask it first. You said, is it really so bad putting someone in a home?
Yeah. Yeah.
Right. So Andy has come out and said, "I'm curious. What are your views for yourself when it comes to old age care?
Yeah.
Would you be willing to go into a nursing home in the future, or would you hope that you would still have someone to you would be mobile enough to care for yourself?" Personally, I do not want to go into an old age home.
Nobody wants to go
No,
into
no.
an old age home.
Because I saw a really good friend of mine go in there,
Yeah.
an old age home that looked really good, and he just deteriorated
Yeah,
so fast.
my grandmother
Of
as
course,
well.
he
Yeah.
deteriorated
But you see,
so
you're
fast.
thinking about, I mean, the fact that you guys have kids,
Yeah.
does
Yeah.
help.
It does.
You know?
It does.
Because you have that option.
Yeah.
Your kids are, there to take care of you. And,
Yeah.
and a lot of the time, I think about this to
at least
myself,
we
right?
hope.
No,
Well,
I
that's what my mom says.
Yeah.
She
At
always
least
tells
we
me,
hope.
don't worry, you have no kids, because, hey, you never know. Your kids might not really take good care of you either. But, hey, she's just trying to console me. But, for someone like me who doesn't have any kids, I have to plan ahead.
Yes.
Yes.
I have to try and keep myself as healthy as possible. Don't take unnecessary risks. And in future, definitely look out for a nursing home for myself, perhaps, and even for my wife. Because in our old age, we are not going to have anyone taking care of us.
Yes.
So I feel like sometimes, right, people who have kids, for example, they need to also think for their kids. Like, okay, if I'm unwell or whatever,
You expect, but
correct. But there
but
is a
there
line
may
there.
be-
I
yeah.
don't want to
Depend.
burden my kids
Yeah.
too much. They have lives to lead as well, So
it's- yeah.
I have to make that hard decision, and I have to check myself in and hope that they come in and
Visit you
me.
every now and then,
You know what I
right?
mean?
Yeah.
Yeah.
Because if not, I don't think it's fair to the children either.
Because some parents can say, "What's the point of having children then?" Because what is the point of having children? A lot of people say it's because then you can look after me and then you
Yes.
can take care of me. Otherwise, what? You just
that's the
go
wrong
off and
reason
live.
to have
No,
children.
but there are a lot of people
You'll
that
be
are
surprised.
like that.
Many
Yeah.
people have kids because that's
Because
at the
of
back of
that.
their minds.
Yeah.
They're like, yeah, when I'm old, at least I have them
Correct.
to take care of me.
But I see your point.
Jerry, you're listening to this conversation. What are your thoughts?
I hope that everybody is healthy enough and mobile enough to enjoy their, senior years. And I agree with what Glenn says. Whether you have kids or not, we want to try and keep ourselves healthy as possible. But where it's not possible, then that's the consideration of having professional care, a care facility that has professional services. Yeah. So,
Yeah.
but if let's say you're healthy enough, my fantasy is if I'm healthy enough to be on board a ship, sail around the world, and then, just pass away very gently.
In your sleep, right? I mean, that for me
Yeah,
is
but
how
it
I'd
is
like
a
to go.
dream.
Yeah. Just
Yeah,
pass away in your sleep.
so we're not talking about, those that are mobile, those that are still very healthy can be. We're
Yep.
talking about someone that is immobile, that may be bedridden, that is not, that really need all the different professional care.
Yeah.
And
I have a
that's
few
the one
uncles
that-
and aunties, right, who are, they're single
Yeah.
and they're in their 80s.
And still.
And they're still, why? Because at the age of 70, they're going to the swimming pool in the morning to have a swim. They're watching their diet. They're still lean, at that age. Why? Because they know they don't have anyone to take care of them.
Yeah.
And they have to take care of themselves.
But I mean, life can always throw you curveballs because you can be the healthiest
Of course.
person and then suffer a stroke
of
the
course,
next
but
day.
you
know
need
what I mean?
you need to do your best.
Yeah. Yeah.
You know what I mean?
Yeah.
That's what it is. If tomorrow you're struck by some condition, I mean, look, that's
At least you can't say you didn't try.
exactly.
Yeah.
But what I'm saying is, for people who don't have children, they have to plan and they have to think about things like that. So people who have children, they need to think that way as well.
Of course.
Pretend they don't have kids.
They don't exist.
How am I
yeah.
going to take care of
No,
myself?
that's true. That's a good way
That's a
to
good
look at
point.
it, actually.
It's a very good point.
Because if you over expect, you're going to be over disappointed as well.
Exactly.
You know?
Yeah.
Yeah. But
Yeah.
that is a good mindset to have.
Yeah. Because you don't want to be in a situation where you're thinking bad things about your kids.
Yeah, exactly.
It's like,
You're
why
like,
are they
oh.
not taking better care of me?
Yeah,
You
why
know?
are they not contributing to
Why
this
don't
and
they
that?
understand?
Yeah.
You know?
Yeah.
So, yeah.
Dr. Jerry?
Well, Glenn is saying, you're in control, be in control, and stay in control as far as possible.
Yeah.
Yeah.
But through it all, let's go back to like the caregivers and those that are not feeling too well. Positive mindset, and keeping that positive mindset for the one that is not feeling too well. I can do it. For the caregivers is just letting yourself know that you are enough and that you are not alone in this journey.
Yeah.
Yeah, so that is very, very important.
Yeah. And I mean, if the family is big enough, I hope everyone can be a caregiver for
contribute.
that family
Yeah.
member. You got to like give each other a break and share that responsibility. I guess.
It boils down to something that an uncle of mine once told me, and I think if you think about it this way, then the family understands. It's a kampong that keeps a kampong alive.
Yeah.
It's the kampong that keeps the kampong going. Just because one person is sick and that person is staying with son or daughter A, the whole responsibility is not upon that
But
person.
I mean, again, I draw from my personal experiences, and I don't think my dad is expecting any of his siblings
Right.
to come by and say to my mom, you know what, you've had enough of taking care of him for let us do it for a couple of days. They
Yeah.
can't expect that.
Yeah.
As much as you say it takes a village to do all this, you cannot expect that there will be people that will come along and
Yeah.
say, you know what,
No,
you
but
go,
I'm-
you go shopping for a day, go to a spa.
Because
and
the
then we'll take care.
siblings are thinking,
You can't-
no, it's the children's responsibility
yes,
already.
there you
They're
go.
the
But-
worst. Sometimes these siblings are the worst. They're from a distance, they'll be bitching, they'll be like judging and all that, but not
absolutely.
lifting a
But-
finger.
Yeah,
Not
but the
lifting
point is, I understand what you say when your dad doesn't expect this.
No.
Right? And he expects children to do it and whatever.
No, he doesn't
But I
either,
am
but,
sure,
yeah.
I am pretty sure, and I please
Yeah,
take
no,
this the
of
right
course,
way.
no.
There are moments when your mum sits back and goes,
I wish somebody
I
else.
wish to God his siblings would come around.
No, I don't know. I don't think my mom says that. I think,
Mm.
I mean, she just sits there and just says, I wish this never happened.
Yeah.
But my mom's not expectant like that.
Can your
or-
mom leave the house for a while?
She can.
or-
We have a helper.
Yeah.
Oh, then you're
but she
all right.
feels
Then
bad.
you're okay.
She feels
Yeah, of course.
bad.
Yeah, of course you
she's
do.
constantly back of the mind.
Yeah, of
what's
course you
happening.
do.
Let's
Yeah,
go back.
so
Let's
I think-
go
Hang
go
on.
back on air. Hold on, Jerry.
Just as we
It's
were
like-
talking about staying healthy and then
Exactly.
sudden health issues.
For someone who's had a heart attack recently, I mean, it's like, come on.
Why
Can
would
you
you
sing
call
about
it-
something else?
Yeah.
You tuned in to Kiss 92, all the great songs in one place. We've been speaking to Dr. Geraldine Tan from the therapy room about caregiver stress this morning.
Yeah, so I mean, FD did ask me, can my mother leave the house while looking after my dad? She can, because they're in the position of being able to have a live-in caregiver in terms of their helper to help them. But even then, you know, in the back of her mind, she's constantly there's guilt. There's anxiety.
Yes.
There is, why should I be
Yes.
going out and having a lovely time while my husband is holed up at home,
Yeah.
unable to
Yeah.
enjoy in, you know,
Yeah.
my walking around and stuff like that.
Yeah.
So she doesn't enjoy it anymore. She used to love it, but now
Yeah.
she doesn't.
Yeah.
Yeah.
So what
Yeah,
would
so,
you say to someone
What
like
do you
that?
say to someone like that? Yeah.
So one with is the fear that something would happen. If I leave the premises, something would happen and I cannot get back on time. But you know, most of the time they are okay. So your loved one will want you to go out, and they want to be a bit more independent also. Some of them don't want you to wait on hand and foot on them, you know. They want to be a little bit more independent. So for example, your dad, you know, he said, why is everybody asking me how I am? Because he wants to feel well. So asking him how he feels terrible. So
Yeah.
either he doesn't want to feel that way, or he feels terrible that day. Is anyone prepared to hear his rant, or is that just out of courtesy that we are asking it, you see? So either way, he gets annoyed, right? So many times we don't realize that our loved one is really just frustrated being ill, and so go and enjoy yourself, and they genuinely want the caregiver to go out and enjoy themselves, so that you bring that positivity back
Yeah.
into the house.
Yeah.
If you just stew in that environment with bitterness and resentment, that's not going to help the whole environment. It's just going to make the whole environment very even sicker. So it's not just physically sick now, you're emotionally sick. And that's not what we want. So go enjoy yourself. Come back, bring your positivity back. Let me hear stories of what is the world outside all about, you know, and I can share that with you. So sometimes, you know, the caregivers are worried that if I go outside and enjoy, would you feel, you know, bad? Why would you feel jealous if it is your loved one, right?
I like that perspective of bringing the positivity back into the home.
That's very good.
Yeah.
Because it does get kind of dark and gray and
Yeah.
like, you know, very, very stagnant if you
Yeah.
don't do anything.
It
So, you know,
is.
I like that.
If you're listening right now and you have your caregiver with you, and you know you love your caregiver, give your caregiver a break once in a
Yes,
while.
Yeah.
Like,
that is
you know,
true.
just tell your caregiver,
Go.
just go out for like an hour or two. You know, I'm okay.
Yeah, but
You
don't
know,
make it
just-
seem like you're doing anyone a favor. You know what I mean? It has to come from inside.
Yeah, of course.
Don't
Of
do them
course.
favors and just say, go, have fun, I'll
Yeah.
be fine.
Everyone needs to you know step back and recharge.
Yes, absolutely.
Right. Okay, Shalini, is it time for us to check on out of here? It is.
Okay.
We don't have any more time with Jerry. Like maybe half an hour more.
10
No?
minutes? No. She's like, no.
Okay.
Going, no.
Oh dear.
Okay, Jerry.
But-
Last words.
Victor Boch says, a smile is the shortest distance between two people. So it's important for the loved one and the caregiver to keep the smile on their face.
Oh, I love that.
Thanks, Jerry.
Thank you so much, Jerry. I hope we've helped a number of people feel better this morning.
Yeah, I mean, it's wrong. It's so many situations
Yeah.
in the chat that my mom can definitely draw from.
Yeah. Okay. Thank you, Jerry. Thank you
Thanks,
so much.
Jerry.
See you next week.
See you next week. Bye-bye.
Bye.
All right. Bye.